Okay, so hi everyone. I feel like we just talked a few weeks ago. Maybe some of you were not on. We did at that time try to predict what was ahead and where we were headed with the revision of the childcare and what we call out of school time guidance. So this relates now to Vermont after school and other enrichment activities, as well as summer opportunities, experiences, and day camp. I do have one slide about overnight camp, which is under separate cover. So I'm going to just dive in. I really want to start by telling you that we have some work to do together to begin to come off of this intensity ramp about this pandemic. And obviously we all share a deep concern and love for children, and children themselves and families have a lot of recovering to do, which you are an essential part of. But we also, as the providers and the thinkers on this, need to acknowledge that some of this is going to feel really strange and other after everything we've been through as it relates to the virus and COVID prevention. So today is just the beginning. I mean, it's April. We're happy to do this as a health department with you in May and June as we continue to hear from you on how this works and where your questions remain. Oops. Okay, so the guiding principle here is that Vermont, with a lot of scientists and forecasters and epidemiologists, have put forth this plan. This is the roadmap for reopening of Vermont, and it's based almost entirely on the percentage of eligible Vermonters who have received a vaccine, at least one dose. And it was launched at the beginning of April. So the metric for going to May 1st to step 2 has already been achieved. We are at 60% of eligible Vermonters have been received at least one dose. And so on Saturday, we're going to be into the orange zone where people can start to gather indoors and outdoors in bigger groups. And I'm not going to go into the specifics about this, but this is where we're really going to start to test this assumption and science that when a certain percentage of a population is vaccinated, the risk of COVID transmission is less. So all the way through until we get to 70 to 85% of people vaccinated, we're going to still be requiring masks and distancing. There are some caveats to that. If you're a vaccinated person and you're with another vaccinated person in your own private home, obviously there's no mask mandate. We still want people masked when they're outside as it relates to moving about and running into other people. That's a little bit different than the CDC said earlier this week, and we'll address that specifically in a slide. And then please note that Vermont Forward is based on vaccine percentage, so the dates are subject to change, with the anticipation that by July, we will be able to remove mandates as it relates to gathering size, distancing, and masking. Okay, several other important contextual sentences that really have come from your asking, and this relationship we have with you and this ability to kind of bat around what makes sense and what doesn't is essential. So the school guidance was revised in March, and that is their rule of law until the end of their school year. So for those of you that are in pre-K programs, part of the public school system in Vermont, you have that guidance. The guidance we put out last Friday about childcare and summer programs out of school time follows Vermont Forward. So there will be a movement toward the masks being only encouraged. But schools, it's all required all the way till the end. The second thing that's of great interest, and I'm happy to bat around with you because a lot of you have asked about this, is are programs allowed to make their own rules here? And the answer is if you receive public pre-K dollars, you have to follow Vermont Forward. But if you're a private program and you want to adopt different guidance, that's allowable, but I really want to talk to you about it. I want to understand which part of the guidance you feel you need to set your own more restrictive policy. And we're a small enough state we can have that dialogue with you, because there is a risk to that, which is it will create an inequitable situation for our community care, that some people are following one set of guidance and then private programs are setting up their own. I wonder about access and equity. So today we're going to highlight these 9 areas: health screenings and travel, return to work if you've had the vaccine, or care if you're a older child. That wouldn't be relevant for your age groups. Transportation, drop-off, pickup, hand hygiene, masks, cleaning, physical distancing pods, and the volunteer visitor guidance. So everyone needs to stay home when they're sick: staff, children. I also always want to acknowledge with you, as we have in every webinar, that this has caused a lot of conflict for you, with families having to really stick with, we can't have kids with runny noses in this program. So we're here to support you. We know it puts a burden on families. We know it's complicated, but it's still an infectious disease principle that we really don't want to slide back from just because COVID's receding. And months and years ahead to talk about making sure we support children and families to have the social policies they need to stay home when people are sick. There's been way too much exposure over the years of our staff and our children to people who don't feel well. So we've shifted the staff and the children, the screening for the list of symptoms associated with COVID and the temperature to personal responsibility, and people should be checking in about their own kids. Now, that being said, childcare providers have always been really charged and empowered to greet a child upon arrival and say, you do not look like you feel well, and to do some assessment. So again, we're trying to get back to best practice here and just not the routine every single kid. So you're welcome to still check temperatures when a child doesn't look well, and please know that that visible check is part of high quality childcare. And then the guidance about return to work or older children after vaccines is really that the vaccine response and reactivity can mimic viral symptoms. So when a person says, oh, I have aches and some chills and a fever, I'm sure it's just the vaccine. We're just taking a pretty hard line here that those folks need to check with their healthcare provider. You don't wander about after a vaccine assuming you're just having a response. It could be another virus. It could be COVID. So don't feel you have to let your staff back in post-vaccine with a shaking chill or a fever. On April 9th, the governor said, no one that travels domestically needs to quarantine. No quarantining for travel in the United States. But when you get back, please get a test. You're required to get a test, but there's no enforcement here. So childcare is not in this space. Don't ask. If the child says he had a great trip to Florida, you don't have to ask, or you shouldn't ask for a test or have to have any regulatory role there. We're just trying to get people tested when they travel, but we're really acknowledging that travel, when it's done safely, is not a high-risk activity. And I imagine you've already experienced this because this is now almost 2 weeks old. International travel is different. There's very specific guidelines depending on what country you travel, and most travel internationally requires quarantine upon return. So transportation guidance, super important for many of you, whether it be a bus, a van, or a car. We're into a new set of guidance here about just best practice. So know where your students are or your children on the bus. That's actually regular transportation safety, is, bus seat assignments in the case of accident. We should not have sick people on the bus. Everyone should be masked until the Vermont Forward Plan is at a place where so many people are vaccinated, we're no longer mandating masks. Our environmental health team still really likes ventilation, and best practice around buses, cars, and vans is to open windows, space children out if you can, But if you can't, the physical distancing rules that we've had all along that have not really been implementable in childcare, 3 feet, have also not really been implementable on buses. So we've had a do the best you can approach to bus transportation in the schools, and perhaps you've already experienced this as well. So this is just think about where you're putting kids, open some windows, and mask until Vermont Forward hits that metric of percentage vaccinated. We spent a lot of time with you last year thinking about the avoiding congregation of parents and caregivers dropping and picking up. And I know a lot of you have implemented times for each family to have their drop off. Now remember, that was in the setting of a health screening. So each child had to be spend a few moments with you, and it made sense to have it be staggered. The public health recommendation now is that you don't want a lot of people congregating anyway, as it relates to just regular infection control, but you certainly don't have to have the stringent guidelines from prior guidance. And the idea that you would need to stagger the drop-off is something you might prefer, and it's up to you. But we've had a lot of parents feedback to us that it was difficult for them. So if in your relationship with parents, you can figure out a way to have multiple kids dropped at the same time, but still feel like you can move them in to your program in a way that feels good to you, it's all on your design now. And as always, anyone that's quarantining because they've been in contact with someone with COVID should not be dropping off or picking up. And, that's going to remain a really important lane in Vermont for several months, which is if people have COVID or they're quarantining as a close contact of someone with COVID, they still need to abide by the public health guidance. Hand hygiene is back to just basic infection control. And I have a slide about the CDC statement on that next. The mask guidance was pretty confusing, and a lot of you sent questions, so I want to state this clearly. We're not backsliding on the strong recommendation for masking. We never required it with our littlest. And you all did a beautiful job with this. This was on the table for discussion for months and months. Almost every state mandated masks from ages 2 and up. And Vermont stayed in a strongly recommend space in our child care settings. That is the same right now. No change to that recommendation until step 3, beginning of summer. If enough people are vaccinated, there will be no recommendation or requirement. It'll be encouraged. And the language really matters here, so I'm going to say it often. But I think some of you read Vermont Forward and thought it meant masks for everyone, like you had to go back there. And I'm so sorry for that confusion. Cleaning is now just regular infection control practice for cleaning. You can pay way less attention to surfaces, and you do not need to disinfect, except in very particular infectious disease circumstances like vomit. So the CDC, this is one of these key examples of how a year into this pandemic, we have learned a ton. This virus does not spread on surfaces. It's extremely low risk. And as you all know, the principal mode by which people are infected is respiratory droplets. So cleaning with soap and detergent is enough. And it comes out later in your questions, but shared materials, sensory tables, soft toys, dress-up clothes, it's all back. But please think about infection control, basic infection control, not COVID. Just, is there anything you were doing before COVID that you want to tighten up a little bit? Like maybe the dress-up clothes had a lot of drool on them, or, markers that go in kids' mouths. Is it better to have individual markers? That's all, best practice, but you no longer have to be so intentional. So with regard to distancing, we're very aware that you are in a great space of doing the best you could. There aren't toddlers in my world that would, sit 3 feet apart routinely throughout the whole day. I know you worked really hard on this. So we still say it in the guidance that 6 feet adults and staff, if they can, stay 6 feet away from each other and children, and try to get the kids to be 3 feet apart. But we're very clear it's do the best you can. We do include best practice in the guidance because it's important to remember with unvaccinated children, there's still going to be cases. And what we're trying to socialize with all of us on this slow off-ramp from this pandemic is this virus is not going away. This is a endemic, it's called, where we will have COVID, we have adenovirus, rhinovirus, influenza, and we've all learned some practices that have helped the spread of those viruses. So why not keep thinking about them as we settle into a baseline of some COVID in all of our communities? So it's just a little more attention to where we sit when we eat, a little bit more thinking about the spacing out of children, and then wondering about music and singing right now. That's still a major cause of spread, and we would like people to really be outside. There is guidance for singing inside, which is in the school guidance specifically to music that you are welcome to read and consider if you want to figure out some music indoors. It's not prohibited, it's just we want you to be thoughtful. So this turned out to be more complicated than we intended, but schools asked for volunteers back, and the guidance that came out at the end of March allows for volunteers if they're vaccinated or have had natural immunity from having the COVID virus. This is self-attestation honor system. So an adult stops at the front of a school and says, I'm here to do, guided meditation with the 3rd grade, and I'm vaccinated. And that's how they're going to roll in schools. So we put it in your guidance as well, that if you have people who bring in enrichment activity to your children, they can self-attest that they're vaccinated or had the disease. We are still discouraging visitors until we get to that higher level of Vermonter percentage vaccinated. People ask if parents are visitors or volunteers. I would let you grapple with that. They fall into visitors in school settings, and I think that's true with you all. If a parent provides a enrichment activity for your children, you could consider them a volunteer if they self-attest to vaccination. And we've always allowed learners and interns, and that continues. We've always allowed field trips. And field trips are now really can go anywhere because there's no travel restrictions, as you know. One slide on overnight camp, and then we'll get to your questions. So overnight camp is primarily written by the Agency of Commerce and Community Development. And they set forth 2 pages, very light guidance, knowing that camps have their own best practice, and they also have a lot of support from their Vermont Camp Association and the American Camp Association. So there's no quarantining for students or children arriving, but they're asked to consider their activities pre-camp just to minimize exposure. And they do have to have a test 72 hours before arrival. Overnight camps are going to follow the distancing and masking from Vermont Forward. And there's just a little bit of attention at the end of the document to making sure that sick people are evaluated, and that cases, which we do still expect, there is still a need to be in touch with the Vermont Department of Health, our contact tracing team. So just a few final points that drive home some of the real sticking points we've heard from you since Friday. So the reason you don't have to quarantine after travel is because cases are low, travel is not a high-risk activity, And over 13 months, only 5% of our cases in the whole state of Vermont have been associated with travel. So we got ourselves really acclimated to a green state of Vermont, and all the states around us were red, and travel was really high risk in our brains, and it is not high risk anymore. So that's a shift that we all have to make. Each time we're able to increase the percentage of eligible Vermonters vaccinated, we're going to be able to see less and less case. And you guys can watch this. It's linear. If you look at each age group, we're in the high 85, 90% of our older populations are vaccinated, and there are no cases. It goes like this. So we anticipate by summer, there will be so many people vaccinated that we can shift masking and distancing back to personal choice without any government mandate. I'm happy to talk in your questions about the health screen. We really want that to be just families assessing their child's health, but we also want you to feel empowered to check in with each student or child, as you do every day anyway, to figure out if they're well. Fever turned out to be a very low percentage symptom for COVID for children. We didn't really know that in the beginning. It didn't make a ton of sense. Fever is a pretty sensitive marker for infection. Last I looked, it was 17% of the cases of COVID in children under 18 presented with fever. And then a word about the confusion that the CDC put out its own summer guidance. It did not address childcare specifically, but for those of you that span different settings, the CDC put out guidance that still talks about masking and distancing, and we want to make sure everyone knows we're using our Vermont guidance. And this has been true all along. We certainly bring the CDC guidance forth, American Academy of Pediatrics, and we look at it and we think about how it relates to Vermont. But CDC has to address the whole US, and Vermont's case rates are lower and our vaccine rates are much higher than many areas of the US. And then I said it again. See, it's important when you say it twice. And then this confusion that vaccinated people can be unmasked outside, according to the CDC on Tuesday. We're still following Vermont forward, and that may change. A lot of people are pushing back on that. So I just didn't want you to think it was time to follow the CDC. If you're vaccinated, you're still masked, unless you're in a very small group of your people but if you're out in public, you should be masked. Okay, so I'm going to skip. I have the Vermont after school questions here, but we did those at an earlier webinar, so I'm going to come to yours in particular because they're pretty specific. And I'm going to pause and check with Brenda that we're still rolling and that this is the right, all set?
We are all set. Thank you.
Okay, and you all have great support and leadership with Let's Grow Kids, and also your Child Development Division childcare licensors who I spoke with earlier this week. So I want to make sure some of this may need more attention from your licensor side. But your questions are, is it really the intention that private programs who receive Act 166 funding will be required to have preschoolers masked? So I addressed this earlier. I'm so sorry this is confusing. It's strongly recommended until step 3 and then encouraged after that. And school-age children are required to wear them until the end of the school year. So again, that confusion that Vermont Forward somehow made it seem like the littlest had to be required is not true, and I apologize for that. What are private programs who have multiple ages or home providers? Will they be put in a position where a family with multiple children might fall under 2 sets of rules? So this, I think, is about travel, that maybe a private program will quarantine kids after travel and a pre-K public funded one will not. So what we want to say about this is, yes, there's a potential for 2 sets of rules if a private program sets up more restrictive policy, but please let the health department know what information you need to understand the safety of the guidance, and also always think about equity. Like if you are making up your own restrictive guidance about your program, I just want to have a dialogue with you about it and figure out why. It doesn't mean you don't have that autonomy, but we are a pretty cool state in our size and the way we're able to talk to each other. And then can we get clarification on who made this decision to line up private UPK with AOE, given that as of 423, this information only come from CDD? That, I'm not sure who asked this question, but that's not accurate. The AOE communicated very clearly that pre-K programs were to follow Vermont Forward, and as well as the school guidance, and then CDD followed that up with communication to you all as well. So there may have been the person who asked this clarification might not have seen the AOE communication, but we've actually been well aligned. Are parents able to bring children into the building and bring to classrooms, masks, no masks? Masks are strongly recommended for children under 5 until step 3 of Vermont Forward, and then encouraged. And masks are required for all adults until step 3, and then encouraged. Someone asked, will child care staff be required to continue wearing masks after state? Not sure where July 1st came from, but I put it in red because the date is subject to change, but it is strongly encouraged after a certain percentage of us are vaccinated. And then children over 2 will not ever be required. 2 to 5, we left it as strongly recommended. Can we get rid of individual Play-Doh and sand for sensory play and other individual supplies, as long as proper hand washing? Thank you for including that. Yes, all materials may be shared with high attention to regular infection practice. Are we able to bring back soft materials? Yes, general cleaning and infectious disease practice. Could you please address if playgrounds will need to be cleaned? No more cleaning of playgrounds. Phew. Again, so much gratitude to you all for your hard work. Staff and children and families should complete an exposure and screening before arriving at the program. Do programs need to collect screening forms? No screening forms. We don't want any bureaucracy here. This is parent and caregiver checking in about their children's health. If the child is then showing up at your door looking ill, you make your own assessment, as always, pre-COVID. No forms. Is it allowed legal to continue health checks? So yes, I mean, legal is not a good word to ask me, but if, we don't want programs being more restrictive than the ones who are publicly funded. But if your private program wants to do them, I don't think we have any ability to say don't, but I just want you to think about, is it just part of your normal childcare practice, which I really support, or is it something you're doing out of a not understanding that the public health recommendation is they're no longer necessary? So just work with me on that, because, and I don't think we have any lawyers on, so there's a lot of legality coming in COVID because of, this might be a question later, can you require a vaccination of your staff? And that's an employment law question. Can you define encourage in terms of mask wearing? Does it mean it's not required, but it's up to a program to determine? No, it's not up to a program. The program is, part of our state saying that this is a personal choice, not a program choice. But again, a private program has more autonomy in that space. But I would love to know why. If you are a private program that wants to require masking, we should have some conversations about that. Will masks be strongly encouraged after 7-4 for vaccinated teachers, since the children in our program will be vaccinated? So the language is encouraged. It's definitely not strongly encouraged, and it's from a state perspective, it's a personal decision. And what I should say, it's April 29th. I sure hope we are down to single digits or 20 cases a day in June, so that we're in a place where we're really seeing that COVID has receded to endemic background regular virus in the context of high percentage of eligible Vermonters vaccinated. So a lot of these questions will kind of become more clear about whether or not this word encourage is intentional. And we'll have to talk more about it, I think, in May and June.
And may I please
continue
interject?
To ask.
Oh, sorry.
Oh, sure, yeah.
I just want to, there are about a half dozen questions around that are just really seeking explicit clarity as much as possible around parents coming into the building. And when you, like the language of parents are visitors and visitors are not yet welcome, and yet there seems to be sort of it's a little confusing. So can parents come into the building? Can parents bring their child in? Can parents walk their child to their classroom now?
Yeah, so again, very intentionally, and the Child Care Advisory Group helped us with this. We picked the word discouraged, which it's not a prohibition anymore, but we're sorting out the feeling of the exposure of a parent that may or may not be vaccinated. So we're saying, let's not do that. That's what discouraged means. Let's not do that for the next few months.
Thank you for
However,
clarifying.
But I really hear you that it's not very clear. But so much of this isn't very clear. I just want to acknowledge that. We're so less restrictive that we want to think it through with more intentional language. So discouraged, not a good idea. Should continue to ask, are you unwell? Have you been in close contact with anyone with COVID? So we've taken away the official screening questions from you all, but our awesome Caitlin Codzis, who's our state school nurse consultant, she found in the Caring for Our Children, our awesome health and safety guide for childcare, there has always been a best practice that you greet a child and say, how are you feeling? And do a visual inspection as well, right? So it's not an official screening question anymore, but you will continue, I know, to do that check-in. Truth or myth? I love that. Can a vaccinated adult contract COVID? Yes. So aren't we so over the moon that these vaccines are 95% effective? We don't have any vaccine pre-COVID that hits 95%, but that right in that metric is 5% of people do not achieve immunity when vaccinated and therefore can contract the virus. We've had breakthrough cases, extremely rare, and no one that has broken through with COVID after vaccination has been hospitalized in Vermont. So it is a rare event, and even within the event, it's a much more mild experience. So there's imperfection in vaccination, but it sure is low in this. I mean, this vaccine is incredible. All the vaccines, all three for COVID, are higher than we ever expected for their efficacy. So if a person who's vaccinated gets COVID, can they give it to another person? Hypothetically, but it is also less transmissible. So this would take kind of a perfect storm, that a vaccinated person somehow broke through and got COVID and then was able to spread it, which is why the governor and now the CDC is saying vaccinated people can mask free outside, because they're showing that it's, well, what we say in Vermont, vaccinated people can hang out with other people in gatherings, smaller groups. So that shows you that risk is minimal, but it's not zero. Anything omitted from the current guidance is no longer in effect. Yes, this has been a very interesting part of this last week. We don't have sections in the guidance that say, so now you can go back to this, or this is no longer a thing. Its absence in the guidance means it's okay, which isn't perfect for the way our brains work, but it is the right way to frame it for the future, because you don't want a document that's loaded with what you can't do, or what you can do. It's really just supposed to be the parameters. So sensory bins, soft toys, dress up, divide and play, all allowable. And then I got to get rid of this bar at the end here. How do you get rid of the bar? I can't see that last question because it's too low on the thing. Can we consider?
Can we consider the new guidance?
Yeah. Yeah. I think I've addressed that several times. I'm going to just say it one more time, that private programs are allowed to think about their own protocols, but I don't know if the right word is stringent, or I guess restrictive. It would be different than the public health guidance. So we would want to talk to you about that. Ongoing need to say that sentence. Okay, next slide. Can we take dress up, stuffy, soft back out? Yes, but attention to infection control, because in pre-COVID, those items were likely to be spreading virus, regular respiratory rhinovirus, but if you can clean them, they're a great part of your play. That same is true of sensory tables, Play-Doh, water tables. Do vaccinated teachers have to wear masks outside? Yes, until we hit that mark where masks are encouraged. Kids who obviously are not vaccinated, what if most of the staff is vaccinated, but one or two are not getting vaccinated due to personal concern? Yeah, this is very important. We're not looking at vaccine rates of staff or adults around children. We're looking at community, meaning Vermont, vaccine rates. So you will not, as a program director or as a leader, be checking in about who's vaccinated, who isn't. I don't think. We're not really in a position to do that. Obviously, legally, if you have your own private program, you may be able to require something, but in general, it's trying to get a community vaccinated, not individuals. Also curious if the guidance is any different in regard to mixing classrooms or group size. We have a small program with a maximum of 24, age 6, with a maximum of 8 teachers. Yes. So we address this in the guidance by not addressing it. We no longer have language around pods, group size, cohorting. You guys taught us a lot about this a while back. We've been mixing classrooms all along, mostly at the beginning of the end of the day. And group size is not a thing anymore. We're just back to, as we head through Vermont Forward, recognizing we're going to keep you distanced, and so you'll decide the number of kids you need to try to do the 3 feet. And then when you hit that threshold at the beginning of summer, you don't have to pay attention to group size. Now, tons of questions come up about this, about contact tracing. So I just want to acknowledge that your whole health department team, the school and childcare branch, some of whom are on today, and our contact tracers and our outbreak prevention group, we're all saying, this is true, this is the guidance, but we're going to revisit it if we have more cases in the community, if this isn't working. And the example I gave on the last webinar is prom. So end of school gatherings are now allowed. Vaccinated high school kids are going to prom. Honor system, self-attestation, and they're dancing. They're allowed to dance, presumably indoors. And the question has come up, what if someone has COVID in that room? Will you contact trace 150 kids? How will you know where that student moved? And we don't have an answer for you. We're just moving toward prom. That's our first milestone. So the way that you're mixing your classrooms and your groups are going to get bigger and you're going to have summer is going to create more questions on your end, I'm sure. What if there's a case? And we'll have more to tell you as the weeks progress. But again, back to a spot where we have endemic virus and it's not as frightening to have a case. That idea that every case has this huge response and energy around it is slowly, we're coming off that ramp. Okay, a couple more questions. I think I'm doing all right for time.
You're great for time. We have 14 minutes left,
okay.
And I think you'll even be able to get to some of the live Q&A.
Okay. This was very specific language, so I kept it in. Can programs choose to screen kids at the time of arrival? as previously described, yes, in the context of regular best practice for childcare, but this sort of everyone has to have the same exact thing and it has to all be staggered, that's not recommended anymore. We often have children delivered without a screening form. So we're not requiring screening forms from here on out. So again, private program has some autonomy there, but I wouldn't recommend it. If a child's delivered by someone who doesn't live with them, can we accept their answers to the screening questions? So again, yes, if you're screening, but we're not recommending that you do. And then the person notes a slippery slope because all the person sometimes knows is what happened in the 10 minutes on the drive. So I would just take that all off the table and do your own assessment of a child the way you do as a high quality childcare person. Our families often do not have thermometers, often don't have the organizational skills to keep track. Still okay to keep a temp check on arrival. Again, not routinely, but assessing a child, wondering if they don't look well, and then taking a temp, best practice. And we are aware that families, I think there are a lot of community efforts to make sure families have thermometers. So that's just a general pediatric concept, and pediatricians can help you with that. We have kids who travel out of state for non-essential reasons. If parents decide to not test, should they remain out of the program? No, there's no quarantining. You're not even asking. And if the parent decides not to test, you have no enforcement or authority to exclude them. But you can certainly say you're required to get a test, because that's the language. So I'm super interested if this is playing out with you all, and the school and childcare branch is here for you, because there's no role for you to know about travel or testing with your students or with your children. Regarding goggles, face shields, gloves, and covering for staff around a potentially sick child. So that PPE, you certainly had it for the daily temp screen. If you're now just assessing a child, the regular best practice, it's not clear to me you need PPE. So I think the off-ramp here is when, and I'm going to rely on the school and childcare branch to get back to Brenda and talk to you about what do you want to do about your goggles, face shields, gloves. Some would say it's best practice for assessing a sick child anyway. Perhaps when we get to an endemic, almost no COVID, the goggles and face shields go away, but you'd still want a hearty supply of gloves. I've told you about the TID. That's a cool medical term. Somebody snuck in on us. That's Latin for 3 times a day. No more disinfecting, no more playground disinfecting. And this person was asking that would appreciate the language. You can quit doing these things. Yes. So the absence of it being mentioned in the guidance means you don't have to do it. And then meal service information is forthcoming. Our wonderful food services person, Rosie Kruger at the Agency of Education, is working on this with Kate Rogers. And so for now, continue pre-plating, as you say, and we will have updated guidance shortly. This slide was some real medical stuff from this person, but I do want to acknowledge that the gift of COVID, if there was any gift, was team-based care and community coordination between pediatricians, childcare providers, school nurses. So all of the stuff on this slide about who's got asthma, who's got allergies, what do you do with someone that's been vaccinated and has symptoms, this requires checking in parents with pediatricians. There's no forms. We don't want it to be this big onerous thing that you have to have paperwork filled out by your pediatrician saying that you've got asthma or allergy. It all should be just doing the team. And if a parent says, my child sees Dr. Holmes and she says this is a seasonal allergy, then I would allow that. But I believe in that approach. But if you want, to call the pediatrician or if somebody communicate with you, you can work that out at a community level. I just know the pediatricians have really said, I don't really have the capacity to fax a form to every child care about every kid with a runny nose in April. And then this goes on a little further to say that cases of COVID in care states that if COVID is confirmed, then below parenthetically, will likely not be known whether this individual is COVID. Seems to be a mutually exclusive statement. So I'll get back to the person who sent these, because we do have this algorithm that's really intended only for health professionals to use with school nurses, but I think this person might have a health background, so we can do that together. Okay, so that's the official slide part. Now Brenda's going to help me with the Q&A.
You are very good at the Q&A, and thank you for answering all of those questions that were submitted when people registered. So there were some questions that I think I answered some of these. I typed in the answers as you were sharing them, but there are some questions about PPE during diaper changing and holding infants, and gloves when temperature checking. Do we or do we not?
Yeah, so I think this is an important body of work to start thinking about the off-ramp of the full PPE. Like, I don't know what you're actually doing. I do know the temp check one, but you're not going to be doing those. So I would imagine are you doing full PPE for diaper changing? That doesn't sound necessary. So I think those questions should be bundled up by Brenda, and the school and childcare branch will get back to you about the different aspects of a day and where we still feel the protective equipment is necessary. And thanks for bringing that forward. I mean, this is continuous quality improvement. I hope you feel that. We do our very best to get it clear in writing, and then we need you so much because we don't know what makes sense. So, okay, what else?
Let's see. So I think some of them are sort of like there's a lot of gray area stuff here. So can we now allow kids to attend if they only have a runny nose? And I think that you've talked about that every time we've met. If you want to just say it again.
Yeah. Well, runny nose is a symptom of COVID. If it's just a runny nose, no other symptoms, and it resolves, there's some opportunity for that child to be in care, but you as the child care provider are in the driver's seat there. And I've watched you all year really build that relationship with families to say this runny nose needs assessment, or just wait a day, and if it goes away, come back. Or I can't really answer the straight up runny nose question, because it could be a runny nose with a kid that's not eating well and has fatigue and it's COVID, or it could be that it's a new allergy because April, or TV. So I want that assessment. And this, I will tell you, because my team is so committed, we want health and safety support for you all moving forward post-COVID. We had this beautiful world for a few years, 10 years ago, where we had nurses supporting your programs and your homes. And to me, that's the lesson here, is none of this can be standardized on a webinar, because there's so much nuance and all COVID's done is put a heightened spotlight on respiratory symptoms. But most kids with a runny nose at the beginning should be home to see if it evolves, right? And then if it's the end and they've shown no other symptoms, then they come back. See, there's the nuance.
There are a couple of questions about association with or contact with people who may have had exposure or had COVID. So here's an example. I have a family who has a 19-year-old daughter who was in school in India. She returned home last night and she's quarantining at home, isolated in her room. Is it safe for the 3-year-old from that family to attend care?
Yeah, I mean, I didn't see in the list who my team is on, but if that 19-year-old is truly isolating, or so the word we use would be quarantining in her room, because isolating is what you do if you have COVID. So if she's quarantining in her room, then yes, the 3-year-old is fine. But if there's complexity to how people move about in the, but I'll just leave it at yes, because it's simpler. I get late in the day, I get more gray. So that sounds straight up. The only person quarantining is the person who traveled.
I think
leave
another
that
one
there.
that I would sort of put right next to that is if a staff member becomes fully vaccinated but comes in contact with someone who has been exposed, does the staff member need to quarantine, or can they come back to work?
Come back to work. You do not quarantine if you have been vaccinated, even if exposed.
Let's see. Yikes. There's so many that are
I
sort
can
of.
go back to the, you want me to go back to the top? I mean, we only have 3 minutes.
We have 3 minutes left. Yeah.
Yeah.
And I think you've already answered some of them. There was one that I thought might just be, you might be able to give a quick answer to. So there's the 101 degree exclusion that is part of the regs, that sort of our guidance, our guideline. And then now there's the 100.4 that came up for COVID. And where are we?
Yeah, we have to look at that. So this is why we need you, because that has to be reconciled. So I'm not sure how it came to be 101. 100.4 is the pediatric cutoff for fever. So that might need reconciliation. That same Naomi question is that liking the temp check. We're in an awkward place where we've heard this from school nurses too. It was a really nice check-in with each student every day, but the state doesn't want to require them. We aren't requiring them. So then if you choose to still do them, I'm not the perfect person to answer who can and can't, because it has to do with regulation and funding. But that being said, if people like it, I don't think the best practice is ever going to be screen everyone, especially because temperature itself is such a I mean, even on its best day, those thermometers and the whole spectrum of its accuracy, I don't prefer. I would prefer that you assess each child, take a look, say hello, and if they're not well, check their temperature. That's Breena's approach, but you'll have to we'll get CDD on this one as well, because they're acutely involved.
And remind us, you spoke to this earlier, but I'm not sure that where. So there is new guidance coming out on cooking with kids and eating with kids. And where are we going to find that? Who's it coming from?
Well, we'll have to reconcile it for yours, because it comes from the Agency of Education, but they also oversee summer. So again, you know more about this than I do. Does Kate Rogers, who is our early childhood person at the Agency of Ed, does she then take it and share it with Child Development Division? It becomes part of the child care approach. You would need to tell me, you as a field would need to tell me who guides your food services. We have been working closely with Rosie Kruger, so it's not addressed in the guidance, as you know.
And
so I will find out about that.
Well, and the food program support people will also be sharing guidance with programs who are involved with food program as they get it. So we are at 2:59. There are questions that remain. Please know that we are capturing these questions and we will answer them in writing and post that along with the slides. We're so grateful that you could be with us today, Breena. And I really like what you said at the beginning. We have work to do together as we come off this ramp of the pandemic. And we will be talking with you and other folks from the Department of Health again next month. And I think we'll just keep the monthly conversation going as long as we have things to talk about. So keep your questions coming. You can always reach out to us at Let's Go Kids. You can always contact the Vermont Department of Health, and we will share, they'll answer your questions, and we'll share the information that we have on our website. So we are grateful that everyone could join us today.
Thank you so much. We'll be back. More questions. Thank you.
Bye, everyone.